Are you pregnant or a new parent looking to ensure a better postpartum experience? Or are you a birth worker looking to improve your postpartum care skills? Check out Thriving After Birth, an online self-paced course by me, midwife and educator Tanya Tringali. It's 10 and a half hours of video content featuring experts in lactation, mental health, pelvic floor health, pediatric sleep issues. You also get worksheets and a workbook, as well as options to have a one-on-one session with me. Sign up at motherwitmaternity.com/thriving, and let's improve postpartum care together. Welcome to episode number 5 of the MotherWit podcast. And a gentle reminder that nothing we discuss on this show should ever be considered medical advice. Please speak to your local provider about anything that comes up in this show that resonates with you and your needs and your healthcare. All right. Today, I am speaking with Dr. Melissa Thompson, Doctor of Physical Therapy. She runs her own private practice in Houma, Louisiana called Louisiana Pelvic Health. Over time, I will speak with many pelvic floor physical therapists, but I really wanted to start off with Dr. Mel because I suspect that we will bring her back from time to time, maybe to answer some questions, address pelvic health topics that you listeners tell us you're interested in learning more about. Dr. Mel and I have some ongoing collaborations. We really enjoy working together. You'll see quite a bit of her in Thriving After Birth. She takes charge of the pelvic floor sections in that course. And today we're going to focus our conversation mostly around the role that a pelvic floor physical therapist can play in your preparation for birth. So we're talking prenatally. So this episode is going to be really great for those of you who are still pregnant. Welcome, Dr. Mel. Thanks for coming and talking to me today.
Thank you so much for having me.
So will you just start off and tell everybody a little bit about yourself? I know you, but our listeners might not.
Yes. So my name is Dr. Melissa Thompson. I am from Louisiana, ended up in Houma, which is actually a small town about an hour south of New Orleans. And yes, there is places more south of than New Orleans. But my husband grew up here, and we just ended up here about a little over a year ago in the middle of the whole 2020 debacle, but couldn't be happier. We are back in his territory, and it's small town living. And I started the practice here that has grown quite a bit in just over a year. And I'm in an office suite in a cute little historic building in downtown Houma.
What was it like being the first pelvic floor physical therapist in a small town? I'm assuming you still encounter many people regularly that don't quite understand you or know what you do.
Yeah. So there's definitely, I use Instagram a lot and to get my message out. And that's where a lot of people find me. And they do say they've never heard of this before, even though there are actually other practitioners here. They just, they haven't really been well known and well talked about. So it's been interesting to see the evolution of getting people, practitioners, everyone just more aware that this option exists. And I think it's been really fun. At first, people are like, this sounds like, I don't know what this is. And then they're come around to it and they're like, yeah, I think I need that. That would really help.
Say things like, you want to do what to me, where?
Yeah, exactly. And then a lot of people would ask me like, how did you get into this? Like, I can tell they're like, you do this all day. Like, I don't know about this.
I love it. That's awesome. Have you had to do equally as much education for the physicians and perhaps the midwives around?
Yes, definitely. That has been something that I've worked on, is just letting people know it's an option. And even if, their patients don't want to do it, it's just great to give them more resources and more options and kind of put it in their hands. And that's definitely been really fun too. And also it's hard to get in touch with all of these busy practitioners and but it's been going pretty well that way too.
Awesome. Now I know that Hurricane Ida really put a monkey wrench in your sweet little practice. How are things going with recovery efforts?
Yes. So even though I'm from Louisiana and I went to LSU in Baton Rouge and I lived in New Orleans for 10 years, this was the first hurricane that completely just made a huge impact on where I'm living, like at the time of the hurricane. I think it's like the strongest hurricane that's ever come through this whole state. And then in Homa is where the like central eye was. So it was like, oh crap, what are we going to come back to after we evacuated? But we definitely ended up having quite a bit of damage at our house. We're still working on getting that done. I'd say we're like 50% done with the repairs, and it's December by this point. My clinic wasn't damaged. So that's been okay, but everybody else in town is dealing with their own damages and work issues. And so I've just been trying to support my clients the best that I can, even if they, had to take breaks from therapy. So, and actually there's a midwife in close to Lafayette who gave me her space since the hurricane to see some of my clients and then also to see her clients, and that actually has opened up like kind of like a mini second location. So it's crazy how you can take just a bad situation, so to speak, and see how it turned it into something I would have never done.
That's so cool. You know what? The reason I thought your practice was affected was because I've been watching you, make that connection. And I thought you moved over there because of damages at your private practice. I guess I kind of got confused between the damages at your house and damages that didn't happen at your practice. So cool. Well, I'm really thrilled that you have a midwife connection over there. That's super cool.
Yeah, it's interesting to see how things go at a birth center too. That's been definitely eye-opening and fun to see.
I'm a huge fan of birth centers, so it'll be interesting to see all the things you learn over time, and we'll be able to chat about that more as time goes on. All right. So my next question for you, you already kind of touched on it a bit, and I'm going to nudge you to do the same thing that your clients have asked you to do. How in the world did you get into this? Like, it is a funny thing. People ask me a similar question, like, how in the world do you end up becoming a midwife? And I feel like we've talked about this many times before. Physical therapists and midwives, or pelvic floor specific physical therapists and midwives, get asked a very similar style question from people.
Yeah, and I guess the reason is because I do vaginal assessments. That's how you would get the true standard pelvic floor assessment, is by doing what we call an internal exam. And so a lot of people are kind of shy about that, and they're like, "Oh, you do this all day?" But yes, I do. And so whenever I first graduated high school all the way back at 18. I was pretty much like a typical 18-year-old. I just wanted to get out of town, see the world, do something different. So I ended up moving from North Louisiana to LSU in Baton Rouge. And from there, I just went on this crazy journey to find myself, I guess. I thought I'll be a doctor. And then I couldn't really put my finger on why I wanted to be a doctor. So then I wanted to be a teacher. And then, I kind of went through like all the different, I changed my major like 5 times before I just landed back on biochemistry, and I got a minor in Latin, and none of which is related to physical therapy at all. So I ended up moving from there and getting my master's in pharmacology. So I did research in the lab on like cell cultures and mice, and like this was like your true science lab that you can picture in your mind. And I ended up writing my thesis on high blood pressure and looking at different pharmacological approaches to prevent high blood pressure. it was a lot of work, and I just still couldn't see myself doing any of that. um, and then I started getting more into fitness on my own, not in any professional capacity, and then started having problems. So I feel
Problems
like,
of your own in your own body.
yes. And I feel like most people can relate. They get interested in something and then they're like, wait, why does this hurt? Um, so I was having a lot of issues with my hips and my pelvis with running, and I could never figure out what was going on. I was seeing orthopedic physical therapists. Um, I was seeing just a lot of different people that were kind of giving me like sort of the answers. And then the pain was coming back again and again. And it wasn't until I saw a gynecologist that I really trusted, who told me that my issues actually are in my pelvic floor, and referred me to a pelvic PT. And I was like, oh, what? And then I was able to start to go through the process myself and see that she was correct that I was in a car accident a long, long time ago, and it actually created a fracture in my hip on one side. Totally fine. It healed just fine, but it left some limited mobility in that side of my hip, and it pulls on that side of my pelvic floor. Mm-hmm. So I can have a lot of tension in my pelvic floor, and finding all the answers to this throughout my journey has really made a huge impact for me, and I want to make that type of impact for my patients. And I just love working through both the orthopedic and internal pelvic floor components. And I personally blend both of those in my business model, so that we really address it from all sides. We're not just looking at the pelvic floor or just looking at the hip. We're zooming out onto everything.
I love that you just said that, because that is one of the things that I refer to pelvic floor physical therapists all the time, as you know, as a midwife and as a fitness professional. And when I'm trying to find somebody for all over the country, basically, a PT, one of the things I'm looking for is to see that they really do still honor their orthopedic background, because there are pelvic floor physical therapists, as much as I adore just about all of them, get a little too much tunnel vision on the pelvis and don't look at the rest of the body anymore. And I know that you know the research really well, so I'm not saying this for your benefit, but I think our listeners will be interested in the research around, for example, knee pain in the postpartum period, right? Like, people don't realize that. They just assume it's completely unrelated and that it's a coincidence. But our body is a chain, right? We're all connected from head to toe. And it's usually that core pelvic floor imbalance in that situation that's sending a message to a different part of the body, right?
Yeah. And it's crazy to think about. I mean, I even see all the different changes in my mama's necks, and we correct the neck and suddenly they have good spinal alignment and their pelvic floor can stop overfiring. So you have to be able to kind of look from all points of view. And, I practice like more holistically. I don't want you to have to see a doctor for your neck, a doctor for your back, a doctor for your knee. I mean, that's just exhausting for the patient as well.
Absolutely. And at the end of the day, it's about getting to the root cause. So if all you see is the pelvis, you're no better than any type of specialist, let's say, that sees your endocrine disorder in a vacuum or sees your cardiac history in a vacuum. All of these things are connected. And we all, as whatever professional we are, we have a huge responsibility ahead of us to do better and see the whole person and see the whole body. And that's, of course, why I like you so much, because we think the same in these ways.
Oh, well, thank you.
Cool. Well, I'm so glad you shared your background with me, because I knew some of that, but I actually didn't know the whole story. And I certainly didn't know that you started out wanting to be a doctor and then did the whole pharmacology and lab thing. That was so cool to hear. So I have a better idea of how you got from point A to point B. Very cool. Okay. All right. So the main topic that we wanted to talk about today, I want to jump right in, is birth prep. You and I have been spending a lot of time behind the scenes kind of talking about, who does what when we're helping people get ready for birth. Like, what's the role of the midwife and what's the role of the PT? And I think a lot of people don't even include the PT in this process, even though I think there's a better public awareness about pelvic floor physical therapy. I think most people, you tell me if I'm wrong, I think most people still think of it as something you do postpartum if you feel bad. So how do we get from there to where you're trying to get us, which is addressing things prenatally, and whether you're addressing a problem or being kind of preventative in nature?
Yeah, that is a great question. And that is something that I have really been focusing hard with my practice. Probably since March, I've really started developing my birth prep leg of my clinic because I just believe in it so much. I've just seen amazing things. I think when we're talking about healthcare and we're really looking at the model, right? You go see your doctor because you have a problem. Your doctor tells you what the problem is and then makes a solution for you or a recommendation or medicine or whatever. This is what you do to fix the problem. Well, it's not always that easy, especially when we're talking about birth and injuries during birth and emotional trauma and things not going the way we thought they were going to go. So I do get a lot of moms postpartum, of course, and if they do have issues, we certainly do address all of that. But there's this whole missed component in the research about preventing issues, or at least optimizing our what control we do have in order to mitigate our risk for all of these injuries, and then essentially make our postpartum recovery shrink down in time. And then we have not only this healing process goes faster, but we have the support of someone who's been with us through the pregnancy, who's not just looking at it from the OB or the midwife standpoint of, is the baby healthy? What's our plan from here with the birthing process? And so I think it's been a really fantastic part of my something that I've been working on. And actually I had one mom that I've been working with since before she conceived. And that has been like one of the biggest like rewards on my side, to not only help her with her pain, her pelvic pain that she had. And she didn't even tell me that they wanted to get pregnant, but we worked together for a while on her pelvic pain. I was like one of the first people she told that she was pregnant. And then she wanted to continue working with me through the whole pregnancy. And now she's about to deliver. And I'm just like waiting for the picture of her and the baby. And I just think that's like one of the coolest parts of doing this.
That is a wonderful story. And you kind of gave me a little goosebumps, because I too, as an individual, and then also just as a profession, I think most midwives feel this way. I love nothing more than when I'm able to take someone from preconception through pregnancy, through postpartum, back into routine GYN care, maybe into another baby, and then, eventually into perimenopause. Like, that whole process is so beautiful, and that connection with somebody over time. And I don't get in my virtual practice too many preconception clients, but I do get a few, and they are so rewarding, because that journey is when somebody comes to you at that point, it's usually because there's something going on and they need some real attention in TLC, and just getting them from point A to point B is beautiful. So I love that you're having a similar experience in that regard. You said two things that I loved. One, you kind of touched on the idea of our current healthcare model, and which it has been for a long time, it's not new, is all about quick fixes. And quick fixes just don't tend to involve those of us or our professions that are very hands-on. So high touch, low tech is what we midwives like to say. I don't know if you guys say that too, but that is where we see amazing outcomes. But because we're not selling a quick fix, no one's going to put in the effort to do quite the quality research that we would need to prove our points, right? So we're always left a little bit in this gray zone where we have to kind of manipulate the data that we have to make our points. You know what I mean?
Yeah, no, I totally agree. And that is the thing with physical therapy is you don't come for an assessment and all your problems are solved. It's just when we're talking about muscles, joints, ligaments, nerves, hormones, it's not going to respond that fast. And so it is not the same as getting a pharmaceutical option for the issue.
Right. The other thing you talked about, and you used the word, one of my favorite words is optimization. I love that. Like that is also why I start helping people with postpartum while they're still pregnant, because we're trying to optimize the outcome or the entire situation, right? You can't just detach and say, we'll take care of you postpartum once you have a baby in your arms. If we didn't make the right choices, and I don't mean right or wrong in a black and white way, I mean the choices that are right for each individual. If we didn't think through that carefully, select our team appropriately, et cetera, we may have missed crucial moments to optimize our postpartum care and well-being, right?
Yeah, and a lot of that for me comes from listening to my mom. So I cannot count how many times I've seen someone postpartum who said, I wish someone had told me this, and that. And they almost feel angry because here they are having this issue and they feel like they're working through it in their mind backwards on what happened, who was supposed to give me this information. They start going to Google. Oh my gosh, there's all this stuff I could have been doing this whole time right under my nose and I missed it. So I've heard that so many times from my moms that I really started researching a lot of birth prep, and I've taken a lot of influences from, labor biomechanics and when labor starts and what activities to do to promote the baby moving down, all the way to physical therapy research and exercise research. And now I have a pretty solid in-person plan for somebody when they come to me. And I would say that's probably the biggest reason I'll get a call is that someone's pregnant. They heard they can prep for their birth and they just want to know everything they can know. They're like 12 weeks and they want to just lay it on me. Let's do this thing.
I think that really sets you apart from other PTs that are out there, because I can't swear to it, but I feel that most pelvic floor physical therapists are spending more of their day with postpartum people. And when I say that, I mean postpartum people who arrived on your doorstep already postpartum.
Yeah, and part of that too is because of the model of my business. So I don't contract with insurance. Insurance does not cover wellness services. Mm-hmm. So if you work in a hospital setting or an insurance-based clinic setting, you won't be able to work with your pelvic PT in this capacity unless they can prove there's a medical diagnosis. And then they will be able to send it through the insurance. But all the training on birth prep would all be falling under wellness, so that it just wouldn't count.
Yeah. Oh, I feel you. You're preaching to the choir. Okay, here's a question for you. And this is a genuine question that I've had for a long time, and you brought it up in a roundabout sort of way. So what I've wondered, since so many people see a PT for the first time, a pelvic floor physical therapist for the first time postpartum, would you be able to help someone differently or better if you had evaluated them prior to pregnancy or during pregnancy, as opposed to only having the information that you have postpartum? Or does it really not matter? Because I've always had this feeling that it would be wonderful to know if, for example, somebody was, had a tight pelvic floor while pregnant, and then you see where they are postpartum. Are they still that? Are they now weak? Does it even matter? Or is this just a moot point and you treat what's in front of you?
Yeah, I think I do take the road of, I'm going to treat the person sitting in front of me no matter what, and I'm going to treat them with the most quality care that I can deliver. If I'm just seeing you for the first time postpartum, we might spend a lot more time getting to know your background and where you started from, because all of that stuff does matter. So, I'm going to ask you about your pregnancy, about the birth. So we might spend just a lot more time of that initial session doing all of that, which is necessary for me to formulate the correct plan for you. Versus someone that I've been working with, like my mom that's about to deliver, I was able to see how her pelvic floor changed from the beginning of her injuries all the way through conception and then into the second and third trimester. And that's also, it was really cool to see it followed exactly the research. So her pelvic floor was a little bit tense because of some low back problems. And as she got more pregnant, it lengthened out, which is pretty typical of pregnancy, just because of all of the musculoskeletal changes, and everything ends up creating a much more lengthened pelvic floor. Mm-hmm. That doesn't mean that you have to have all these symptoms like leaking pee, but it's 9 times out of 10 going to just go that way. And so that was interesting to see. And then since I know her so well, when we kind of debrief after the birth, I have all this history already in front of me. So we just don't have to spend as much time like getting to know what exercises have you been doing during the pregnancy? I already know that. What have you tried? Like, I'm already up to speed there. But long story short, these two individuals are still going to be able to start at the place where they're at.
Got it. So the treatment plan isn't going to change based on whether you actually got your hands on them prior or not. It's just that it's going to have a really different feel because of how much you intimately know someone's body and their previous experiences and how they've responded to various treatments before.
Yeah. And then, I can't do any, I can only do anecdotal research on this, but, if someone had been working with me and other birth prep practitioners or materials, maybe their injuries are a little bit less. And, this is something that I always like to bring up. We can't control everything. There's going to be things that come up that you can prep all day and do all these different things, but maybe you still had some kind of a tear, or there was an emergency. We do have to understand that these things can still happen in light of being 100% prepared, but there are things in the physical therapy research that we definitely know do prevent severe injuries. And so it is interesting to see that also has followed, my trends have followed the research, that working on pelvic floor health during pregnancy, outcomes tend to be a little bit better.
Right. We're going to skew the statistics. We can't solve every problem in advance, but we're going to skew the statistics seriously in the way that we want to see them go.
Yeah. Yeah.
Okay. So going back to birth prep as a topic, can you tell me what it is exactly that a pelvic floor physical therapist brings to this discussion that perhaps a childbirth educator, a doula, or even a midwife doesn't bring? Or let me rephrase and say, is it the case that you got down this path because you were looking at other professionals' versions of birth prep and you were seeing a lack of something specific?
Yes, exactly. So I don't teach anything like Lamaze or the Bradley method or anything that I would consider like specific childbirth education, because that information is abundant and it's out there, and you can easily find someone who can teach you that. What I didn't see was specific education on what's going to happen to the pelvic floor, what is supposed to happen to the bones of the pelvis, to the spine, to the muscles of the back and the abdomen. What should you do to prevent these issues to the pelvic floor? And then from delivery on, how should you what should be in your mind to know of how the healing is going to go. That is the type of information that I don't see being out there. So when a mom comes to me, I'm going to do a full musculoskeletal assessment of how she's moving, what her lumbar spine, thoracic, her neck, her all these big motor control things that's more orthopedic in nature. And then we're going to start putting things together with how the pelvic floor is interplaying. We're going to assess for current issues, clear up issues that might be already present. For example, a lot of second-time moms will say, I feel like I'm peeing all the time. I didn't have this in my first pregnancy. Start clearing those issues up now. And then once those improve, we're going to move towards, okay, tell me who's going to be there with you at the birth. What labor positions are you thinking about? Why are you thinking about those positions? What's going on with your pelvis in that position? What are you going to do with your pelvic floor? Do you know how to relax your pelvic floor? Do you know how to contract your pelvic floor? And I'm actually going to have these mamas do this for me. And we would, I actually get a lot of moms that either don't understand the terminology, so they do the wrong thing at the wrong time, or they just simply have never been asked to let their pelvic floor go or to Kegel. And we've got to get that right before we're in the delivery room, because we've got to be able to relax and let our pelvic floor go. And that is one big risk factor for tearing, is if we're bearing down or we're guarded or we're Kegeling when the baby is crowning.
Yeah, it's interesting that you say that, because of course, when I do a vaginal exam on a person, it is different than when you do a vaginal exam on a person, for sure. But I do ask all people to Kegel for me, so I can get a sense of whether they have control over this muscle or not, whether they do it right or not. And it is interesting how many people bear down when I ask them to Kegel, and then I explain what I want instead, and then they bear down again. And so you can see, just from going person to person to person, how much variability there is in one's sort of mind-body connection, for lack of a better word, and that it can take some time and explanation and trial and error with some people. And that's just at a routine GYN exam, let's say, or even sometimes at a 6-week postpartum visit. But yeah, I totally hear what you're saying. I want to I think I know the answer to this, but I want to get it out there for our listeners. You aren't suggesting the type of birth prep that you do as a replacement for all the other pieces. You just want this added into someone's prep, right?
Yes, absolutely. So like I said before, this is not Lamaze. It's not the Bradley method. I'm not a doula. We're specifically honing in on the musculoskeletal system. And of course, it's all birth is all things are going to come up that might come up with the doula and these other practitioners, because once the brain is flowing with all these questions, I do get asked a lot, well, how do I decrease my risk for a section? Or do you think I should get the epidural? Or should I get the episiotomy? And my job is less in the role of telling people what to do, but providing you what it is and letting you know why would we even ask the question? What's the benefit? What's the con? What's the increase in risk or decrease in risk? And then I arm you with your own knowledge, and then you make your decisions.
And so now what you're really touching on is the pelvic floor physical therapist's role behind the scenes, sort of, in advocacy and in teaching people how to be their own advocate. Because when somebody comes to you and says, should I have an episiotomy? There's a lot of information you're getting because of that question, right? Like, that's a lot to unpack. We can give you a simple statistical answer. We can tell you why or why not we think episiotomies are good or bad, but the simple fact that that question's being asked makes me have many more questions for the client, right? Like, Are you asking because you heard a horror story? Are you asking because perhaps your provider suggested it. Or, I mean, whatever, there's a million possible reasons why someone could ask that question. And without digging a bit deeper and figuring out where they're coming from, we don't know.
Yeah, exactly. And, I try really hard to be a support practitioner and not a governing, you have to do this, you have to do that, you have to do that. I still want my moms to feel comfortable in their decisions and not make their decisions because of anything that they felt like they had to do.
Sure. And you're really good about knowing when something has veered a little too far out of your scope, right? That's sometimes when you reach out to me and have a conversation, or maybe you refer somebody to me. These are really great relationships to have, because my knowledge base ends somewhere and then I really need you, or vice versa. So we have to have these really great teams with people we trust that we're on the same page with in order to provide really good quality care to each individual.
Yeah, absolutely. And I have that conversation all the time. Well, in the PT scope, I can look at your muscles, joints, ligaments, and nerves. I can't diagnose technically medical conditions. So when things look a little like, I think this is something else, I'm usually very hands-on with, we need to go see so-and-so to get this piece of the puzzle figured out before we move on with anything else.
Well, you bring up a really good point also, because the referral process tends to go from OB or midwife to pelvic floor physical therapist, but it actually can go back the other way, right? So we as OBs and midwives have a responsibility to say, instead of saying, oh, you're fine, or whatever we have heard 1,000 times, to say, you know what, that's likely a musculoskeletal issue, and that's not what's in my scope of practice or my training. I wasn't trained to help you fix that. So let me get you to a pelvic floor physical therapist. Likewise, if you're doing your thing and you're like, you know what, I think there's something gynecological going on here, you got to go back the other way. It's just that it doesn't tend to go that way as often. But it's important that I think consumers and even healthcare providers remember that this is a two-way street and a constant ongoing conversation.
Yes. And, when we ask the question, like, what's in the best interest for this patient, that's where it starts. With physical therapy, being a doctorate level, our main job is to use our differential diagnostic skills to ask the question, is this musculoskeletal or is it not? And that is an answer I should be able to get to with an exam. And if things don't add up, like in the case of undiagnosed endometriosis, I try my best to provide them with a proper medical referral source, because it has to be cleared up. And I use endometriosis, even though that's not necessarily like pregnancy type topic, but endometriosis can present with severe pain with sex. But undiagnosed reason for pain with sex is concerning to me, because how many different medical things can cause painful sex? We have to ask that question. Infections, something with the cervix, STDs or STIs. I've got to have a patient with all of that ruled out before we can even touch the muscles. And a lot of times what I'll see with endometriosis is they'll have all that ruled out. So we know there's no infection, yeast infection, bacterial vaginosis, no abnormal pap, but there's still no diagnosis. And I'll think, man, this just presents so much like endometriosis. And so then I'll actually send them back to another gynecologist who I know specializes in that area, so that they can get, proper collaboration for this complex problem.
Yeah, so I want to give an explanation to our listeners about a technical term you used, because I actually think this is a word or a phrase that consumers should know, and yet we tend to use it in medicine and in healthcare and then keep it like it's a secret from consumers. You used the word differential diagnosis. And I love that word. I mean, it's something that we all spend, it's basically the work we do in medical school, midwifery school, physical therapy school, whatever medical program you're in. It's really at its crux about understanding differential diagnosis. So I just want to make sure our listeners know what that means. So differential diagnosis is when we say what you are feeling or experiencing, your symptoms, could be any one of these things. And it can be a very long list or it can be a very short list. And then every piece of information that we gather, either from things you tell us or from our physical exam, helps us, what we might say, rule in or rule out that one of the items on that list. So I can knock something off the list the second you tell me something and I know, okay, it's not that. I've shortened my list by one. And then I get a lab result and I've shortened my list by another, and so on and so forth, until we get down to the one proper diagnosis, right? So that's kind of an explanation, a simple explanation of what that means. And I think it's important that you know that that's how we think as healthcare providers, so that you can kind of, I don't know, I think it'll help you engage a little more deeply in conversations with your healthcare team about your own healthcare. Do you think that was helpful to our listeners?
Yeah. And as I was saying that word, I was like, maybe I shouldn't say this, but it is the best way to describe what we do, because that is the purpose of the evaluation. Even though you may not receive a lot of treatment that day, we cannot base treatment off of something we have not diagnosed. And so with the physical therapy, that looks like figuring out, well, is this pain with sex because of a muscle in the pelvic floor, or is there actually something going on with your lumbar spine or your hip joint? Like, what's the true driver and what's the victim? And let's bring the story together so we can treat properly.
Yeah. And on that note, also, this is the point of this podcast also, is to demystify some of these things. I said this in my first episode, but I know people are going to jump in and start listening at various points and maybe not work backwards. Sorry, I have a dog barking in the background. Hopefully you can't hear it. I want to make sure that this is a conversation, this podcast, not just between healthcare providers on one end and between consumers on the other. I really want consumers to feel that they can engage in the conversations that I'm having when I bring healthcare providers on. And I want to demystify these topics and these terminologies. So I love that you kind of thought that thought and then went for it anyway, because that's what this is all about. I want to make sure people get a little bit deeper and feel like they're like, oh, I get it now. That's what I'm wanting for people. So thank you for actually going there and saying that. Okay, one more question for you about birth prep before we start to wrap up. I'm wondering if you can articulate or elaborate on the ways in which you think partnerships should be forming between pelvic floor physical therapists and all of the other players who most commonly engage in birth prep. So that tends to be childbirth educators, doulas, and midwives. Do you have particular thoughts and feelings or strong opinions about what we should be doing in order to make sure that we're incorporating this information in our education to our clients?
Yeah, I think that, in a perfect world, everybody deserves a referral to a pelvic PT for at least one assessment, to see what the pelvic floor is up to make sure they know how to use it. And so I would love for all of those professionals to work together, instead of I don't want people to feel like they have to choose. Like, I'm not your doula just because I'm working with you on pelvic floor birth prep. And then vice versa. Like, I think it would be great, depending on your personality, of course, for the mom to work with all of these different professionals and have this just robust birth team. And I believe the research does show that the more we have a team and the more we're educated in these different niches, the more support and empowered the mom feels. And typically when you're very empowered about your birth, the better the outcomes.
Yep. Love it. Love it.
Do you have a comment or suggestion? Are you interested in being a guest on the show? Are you interested in partnerships? Leave me a voicemail at 917-310-0573 or email me at Tanya, Tanya, at motherwhitmaternity.com.
All right. So as we move towards wrapping up, I'm going to ask you to play a little game with me. It's not really a game. It's a little segment that I'm working on. This is my third time bringing this up on the show, and I still don't have a name for this. And so I'm still soliciting from our listeners a better name than what I've been calling it, which I've been calling it Shame on You. But I've been calling it Shame on You because it was a segment from local news when I was a kid. So right before we started recording today, I Googled it on YouTube because I wanted to make sure my memory was accurate. And I found the little jingle for Shame on You from 1993. So I will put that in the show notes, but I'm still soliciting a better name because I don't want this to be about shame or to be shameful. But I do have this like finger wag, shame on you idea in my head as we go through this. So Dr. Mel, can you tell me one of the, like either a story or a kind of a global concept that you encounter in the healthcare system that you think is just not cool? Like it's something that a provider just shouldn't do.
Yes. So something that easily comes to mind is hearing from my patients who find me anyways, because they still have this problem, that when they brought it up to the OB, they were told, don't worry about it. It will get better. And then they feel all kinds of insecure because the OB told me it would just get better. What's something, maybe it's not that bad. Maybe there's nothing really wrong and I'm just making it up. And then months go by, way beyond that 6-week visit. They still have the problem and they just call me on their own anyways. Mm-hmm. That makes me so mad because I understand what they're trying to do. They're trying not to make maybe like an unnecessary referral if it was going to get better on its own. But if a client is asking for a referral to physical therapy or they are curious about it, why are we denying them that?
You want to know what makes me even more mad than what makes you mad? All the people that didn't come to you anyway.
Yeah, I'm sure that has happened.
Yeah, more time.
I don't have a calculation of that.
We don't have a statistic for this one, but what I can surmise from the numbers of people that I talk to that have grown children, and obviously times have changed dramatically. So I realize this is not a perfect analogy here, but there are plenty of people with grown children who say things like, oh, I just have to live with it. Oh, I just pee when I laugh. Oh, I'll never jump on a trampoline or whatever. I'm giving you just a few random examples that just happen to be about peeing, but there are obviously other problems like pelvic pain and pain with sex and just all kinds of stuff. And people go on forever like this because their provider hinted at or explicitly said, this is your new normal, right? And that's even more upsetting to me than the people who found you anyway.
Yeah, and I'll do you one better. I've even had clients that started with me and then they already had an appointment scheduled back with the OB and the OB said, you don't need to be doing that. Oh. And now we're just putting a lot of doubt in the mama's head, right? And at the end of the day, you know, taking care of your body through physical therapy treatment is so much gentler and more conservative than other medical options.
Oh, yeah. I mean, because we have to remember that, for instance, let's just stick with incontinence for a great example. Incontinence will pretty quickly get you to the urogynecologist. And what's the urogynecologist likely to do? Not pelvic floor physical therapist. Invasive tests that are uncomfortable and recommendations that are often surgical. And I'm not saying that's every urogyne. I don't mean to generalize, but this happens. And I strongly believe that we should be referring to pelvic floor PTs before we go down that path, except for in some very extreme cases or some rare diagnoses, but not the typical postpartum stress urinary incontinence situation, right? Oh boy, we got on our soapbox. See, that's what happens when I do the little shame on you segment. Let's get on our soapbox. But the whole point of doing this is that I want to, once again, expose our clients to a certain way of thinking, our listeners in this case, to a certain way of thinking so that you feel really empowered to build a team for yourself where everyone's on the same page, where maybe you're encouraged to see a PT before you have a problem. That is a sign of a really open-minded, awesome provider, right? That's what I want for you guys. Anyway, I'm going to hop off my soapbox, and Melissa, thank you so much for this conversation today.
Yeah, thank you for having me. I enjoyed it. These hours always fly by.
Totally. Well, I as I said at the beginning, I have no doubt we will have you back for I don't know what reason, but I know that we will. So I will be reaching out to you again in the near future. Thank you so much.
Can't wait, and Happy New Year.
Happy New Year. Yes, we are recording this on New Year's Eve, 2021. Happy New Year, folks. Everyone, it's me, Tanya, your host here at the Mother Wit Podcast. You know I sometimes invite my clients on the show to talk about their birth stories and postpartum experiences, but I want to tell you a little bit more about what those clients and I actually do together. I started Mother Wit to help people in the perinatal period achieve their health and wellness goals. That means whether you're hoping to conceive and struggling with high blood pressure or high blood sugar, or you're having trouble managing anxiety or depression in the postpartum period, or maybe you just need support and advocacy between prenatal or postpartum visits, I can help. Get a discount on your first consultation with me at motherwitmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. I'm looking forward to working with you and maybe having you on the show too.